Atlanta Area Evaluation Association. Just to give you a little bit of background, we initially started talking about this this town hall, what is now a town hall, a few months ago. And at that time, we were hoping to do a webinar on culturally responsive evaluations. And so Sarita and I were planning to discuss our history and our project work in culturally responsive evaluations. However, as COVID-19 got worse, and they were starting to reveal the information about disparities in COVID related to COVID-19, we decided to, and it was primarily Sarita who decided that perhaps we should switch gears and make this a town hall in a way that we can all do information sharing, we can share resources, and talk about what we can do as a community of evaluators to help and to assist the situation as it relates to disparities in COVID-19. So that is just a background of how it kind of morphed into this town hall discussion. So, but we're really hoping that everyone is willing to participate, and I'll talk about that a little bit more. But as we get started, I just wanted to share, my name is Linda Bafo. I am also the Communications Committee co-chair of the Atlanta Area Evaluation Association. And this hit home for me because I grew up in New Jersey and my family still lives there. And the majority of my immediate family work in the healthcare field in New Jersey, where, as you can imagine, it's been really devastating, both New York and New Jersey. And so this is definitely something that has been on my heart and on my mind. And I'm excited to be able to share with you some of what we can do and what I hope to be able to do as it relates to working in culturally responsive evaluations in COVID-19. Sarita.
Thank you, Linda. I am so glad to see some of your faces and to see names of lots of folks on today's call who are interested in this topic. I'm Sarita Skelton-Wilson, and I have been fortunate enough to work with a number of diverse populations from underserved communities, disadvantaged youth who are in the juvenile justice system, youth who are in the child care and foster care systems. And I also do a lot of work with youth in K-12 schools. In addition, I have been doing some evaluation work supporting American Indian, Alaska Native communities. And so this was a topic that Linda and I had been talking about doing some collaborative presentation on for some years now. And initially I was going to be talking about my limited experience working with Pacific Island communities and some of the lessons learned as an evaluator and what I took from those experiences and reflecting on the importance of culturally centered approaches to evaluation. And when we began talking about a presentation to share our project work within that area, the big report that the Associated Press had done was released that was showing some of these really stark and jarring statistical information about how the coronavirus was impacting communities of color. And my own personal experience is that I grew up in Long Island, New York, and I have a lot of friends and family who still live in the tri-state area and live in New York City and in Long Island and the surrounding areas. And just about every week since the last week of February, I have heard personal stories of people who I grew up with, classmates from high school, co-workers, family friends, and a best friend of mine who have been either diagnosed, hospitalized, or succumbed to COVID-19. So um, I just thought that it would be appropriate to maybe shift our discussion to give a forum to other evaluators to utilize our talents and our positions of privilege to talk about how we can address some of the issues that certain communities are facing during this time, whether that be through our direct work that may not be specifically related to COVID-19, or if we are in a position to do some work directly related to this issue, how our practice, how our everyday work and approach to intersecting with these communities can be tailored to minimize trauma that's happening right now, to try and empower and give these communities a voice so that their needs can be prioritized and heard, and to talk about the ways that we as an evaluation community in Atlanta can support one another in carrying that charge forward. So that's kind of the impetus of this discussion, and how we're going to start it off is we're going to just lay some ground rules, and then I'm going to set some of the stage for the background on COVID-19. Linda is going to then help us frame culturally responsive evaluation, and then we plan to have an interactive discussion. So I'm going to let Linda take that part away, and she can talk a little bit more about how we'll be conducting our engagement for this session.
Okay, thank you very much, Sarita. So again, this is a town hall, and the hope and the focus is for us to start a conversation about possible solutions to empower disenfranchised communities. So what we're hoping to do is for this to be an interactive experience. We will have some discussion, didactic discussion as well. However, we want there to be a full-on group discussion and information sharing, as I've mentioned earlier. So some etiquette that we just want to share with you is, number one, make sure to be respectful. That looks like making sure to mute your mics if you're not talking, but then listening to whoever is talking. And then also making sure to be respectful of everyone's viewpoint. We may not all agree. However, we want to make sure that this is an environment where we can respectfully disagree. Again, discussion is encouraged, so feel free to contribute. When the time comes, you are welcome to unmute yourself if you want to share your voice, or you can use the chat function at any time to share any ideas, questions, and the like. So we can go ahead and move forward at this point. Back to you, Sarita.
Thank you, Linda. Okay, so as we said, we're going to have a discussion about culturally responsive evaluation, and the focus of this discussion is on how our practice can help marginalized communities that are disproportionately grappling with negative impacts of COVID-19. And we want to have a robust discussion that can help us advance our culturally responsive evaluation practice as a community of evaluators in Atlanta. First, I thought it would be good to set the stage by just defining and maybe coming to a common understanding of what culture is, since it is at the center of culturally responsive evaluation. My understanding is that culture is is influenced by a lot of different factors, but at the crux of what is culture are established beliefs, values, tradition, laws, language of a nation, society, or other defined groups. So in other words, culture is what makes us who we are. And evaluation that is culturally responsive is based on an examination of these factors and centralizing it through the lens of how we are working with, seeing, and showing up in communities. So for all intents and purposes, we want to recognize that factors that influence culture can include a lot of different things: age, race, ethnicity, and there's a long list that I won't read here, and other things that may not be included in the list. But I wanted to raise these factors because so much of what we are coming to know about COVID-19 is that age, race, ethnicity, and geographic location, as well as nationality, are really important areas where we are starting to see emerging data that are helping us to understand areas where there are disparities. But what I now want to talk about is some of the gaps and the holes in the data that we are getting information about, so that we can come to understand how the information that we do have can inform what we currently know, and maybe even inform the things that we want to look at in the future. So here are some of those variables. Just to get us started, I wanted to start with, like, what is the picture of COVID-19? What did it look like as of yesterday? Because the one thing I can say is these numbers change every day, and there are so many different sources of information. So we're going to look at a number of different sources of data and what they're telling us about different communities that may have cultural variations through which we need to center and focus our work around collectively. So this set of data is just showing the picture of cases from the global level to the national level to our state level. And it's showing us confirmed cases and death counts. And these figures are being compiled through a number of different sources through Bing search engine. And those sources include the CDC, the World Health Organization, the Wall Street Journal, and a number of other data trackers that are looking at COVID cases and deaths. And these figures are updated in real time any minute. So if you go to the Bing site and just type in the search COVID-19, it's going to pop up with these trackers. And then they have a map, an interactive map that is a heat map, and you can zoom in to the specific locations, specific states, counties, down to the city level. And it gives you specific data about cases and deaths in those areas. It also gives you the most current news stories that are related to each of those areas. And what we're seeing is that as a nation, that there are differences not only geographically, but also within certain demographics within regional areas. I wanted to share some information about how these different experiences that varying communities are having with COVID-19 are, are evident in questions that they may be getting surveyed about different populations. And Pew Research Center recently did a study that was conducted during 1 week in March of about almost 9,000 adults across America. It was a cross-sectional panel study. And I pulled this one question out because I thought it was particularly pertinent to today's discussion. And their study has this data exploration dashboard that you can go to, and it has a variety of topics that range from political attitudes, views on the economy, emotional and personal health impacts. And I just pulled out data from this one survey, which shows that overall, there are communities of color that we are coming to know or grappling more with the negative impacts of coronavirus. They looked at general population and asked them to what degree are you concerned with coronavirus being a um, a negative impact on your personal health? Um, and among the whole group of respondents, almost 9,000 people, there weren't a lot of differences, and a minority of people, 27%, felt that it was a major threat, where the large majority, 51%, felt it was only a minor threat. But when you start to break these statistics down by some of these demographic and cultural factors, such as gender, you start to see some differences. Looking at gender, slightly more women than men found this pandemic and outbreak to be more of a major threat to their health than men. When you look at age, older adults, 65 and older, overall have a larger percentage that feel that the coronavirus is a threat to their personal health, as opposed to a smaller number than people who are younger than that group. And when you look at race, that's where you start to see really, really big differences. Um, among among different racial groups, um, you see that African Americans were the largest group of folks who felt that coronavirus was a major threat to their personal health. 46% of African Americans who were part of this survey felt that this was a major issue to their personal health, as opposed to other groups that were part of this study. And then when you look by education, there is a slightly higher amount of people with less education who felt that coronavirus imposed a larger threat to their personal health. And the study did look at variations on this question by health insurance status, and they found that there was slight differences. So these one data point that was dissected by these different demographic characteristics show that there's variability among different types of people, different groups of people, and that includes where they live. And I think I glossed over rural and urban status, but there were also slight differences there as well. And I think we have a lot of data that are quantitative surveillance systems, survey data like what we just saw with the Pew Research Center, that are giving us cues about this, but we're also seeing it in other types of information that are not necessarily formalized studies. But if you just take a scan of news stories that are available on various media sources, you'll see that there are a variety of community issues that are bubbling to the surface. And this is just a depiction of some of the current headlines in different news stories that are highlighting different populations that are being impacted. There's impacts around communities that are rural, remote locations. There's impacts on the unhoused, impacts on incarcerated peoples. There's impacts in Indian country, impacts on migrant communities. There's lots of different impacts. So it's important, I think, to pay attention to this as you may be working within some of these communities, just to understand that they may be grappling with new and changing environments that may affect how you normally work and operate in those settings. This next graph I pulled from National Geographic, which they compiled a number of figures, I think, that were first published by the Associated Press, and they were wanted to look at disparities in the proportion of African Americans who were affected versus the proportion of African Americans represented within different states. And this data represents I believe it's 24 of the states that had racial demographic data available at the time, and this reflects data collected in mid-March. And for these states, all except for Washington State, the proportion of African Americans who they term as victims, and they don't define in their study or their publication what victim means, but I assume that it means cases of confirmed cases, that there is a disproportionate number of victims to the amount of folks who are represented proportionally in these states. So every place where the dark blue bar is longer than the light blue bar is a representation of a disparity. And these numbers represent proportion of COVID-19 victims who are African American. So it's like a percentage, and the proportion of African Americans who are represented in each of these states. And almost 1/3 of people who are infected nationwide have been African American, although African Americans represent only 13% of the population. So we know that this is an issue on the national level. Um, these disparities, in particular within the African American community, and I really shouldn't say African American because these are really Black people, and I would assume that it includes Black people who may be from the Caribbean or from Central or South America, and all over the world, but they identify as Black. Um, these disproportionate rates also show up in CDC surveillance data on hospitalizations. And this particular slide is one of several data visualization products that are available on CDC's website, which is called COVIDNet. And the COVIDNet is a surveillance system that observes hospitals within over 5,000 counties across the country. And the hospitalization rate for non-Hispanic Blacks is larger than it is the proportion of people who are represented in COVIDNet counties, which are the counties where these hospitals that are part of this surveillance system are represented. So these disparities are becoming more solid when you look at more and more data sources. This particular study is showing some of the disparities that are beginning to emerge between rural and urban communities. And I think within the last couple of weeks, there has been more of a shift to seeing a rise and an increase in the number of cases in rural communities. And the Kaiser Family Foundation published its own study of its healthcare system that's looking really at hospital readiness. It's looking at readiness of the healthcare system within rural versus urban communities to determine not only readiness, but also burden. They collected factors including the proportion of people within urban and rural communities that their health system covers who are low income, who are considered part of the high vulnerable population, which would include people with pre-existing conditions and older adults, 65 and older. And then they also looked at the number of urgent care beds in the hospitals that serve these communities. And overall, they see that we know that there are higher death rates in urban communities, but there is a rising number of cases in rural communities and a disproportionate number of hospitals that don't have facilities to care for people who get sick. So they're trying to keep an eye on this, and I think that the more that we're learning about geographic disbursement of people who are affected by COVID, what we're seeing is that there's maybe more burden and less readiness in rural communities, which is a problem that they're trying to get a handle on. CDC also has a surveillance system through the National Vital Statistics database, and it is tracking deaths from coronavirus across the country. This is different than the surveillance system, the COVID net surveillance system that I mentioned, which is looking at hospitalization rates and does also collect information on deaths. But these are statistics that are projections based on population counts across the country. And these data are published weekly. And here, again, we're seeing disparities in the number of deaths when we're looking at projections across the country. And here it's showing disparities not just among African Americans, but among people from Asian descent and others who could include multiracial people. Now, I just wanted to end the review of data that we have available from different sources to prime us for this discussion with a view of what is happening in our state. At least those of us who are part of the Atlanta Area Evaluation Association that live in Atlanta, in Georgia. And we know that within the last couple of weeks, Georgia has started to see a rise in the number of cases. The Georgia Department of Public Health also has a daily status report, and these are data pulled from their site from yesterday on Tuesday. And they have a heat map that shows you confirmed cases by county. It also gives you the option to look at confirmed cases by every 100,000 people. And the numbers in red show the clusters where there are the largest number of cases, and of course that's Metro Atlanta. But they also are tracking data by race and ethnicity, which are shown here. And again, we still see the same disparities holding even at the level of state of Georgia. So I spoke earlier about what data we are seeing become more predominant, and these are by and all not not expansive. They are not comprehensive. Number of sources. There are many, 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 many more sources, but I chose to share those that I thought would be helpful for this conversation and those that are easy to access. That was the Bing, accessible to lots and lots of people. And they also have an app, but also the predominant federal authorities on public health, which is the CDC and its various sites, as well as for the local level, Georgia Department of Public Health. But there are many, many more sources that folks can look at. But among the sources that we have reviewed, we know that there's a lot of data coming out about race, but still, even in CDC's sets of data, demographic data are missing for race and ethnicity 56 and 60% of the time. And then there are a whole host of other variables that aren't being tracked, things like access to testing by demographic groupings. And so I think that the inconsistencies in the availability of these data, once the Associated Press published their report in mid-April, rang the alarm for some people, and some of our lawmakers at the federal level in Congress put forth legislation that they wanted to advance to mandate the collection of surveillance data around COVID-19 that would include demographic variables. And since shining light on that, we've seen the floodgates kind of open. And every day when you go to at least the CDC sites, you see new variables and reports coming out that are inclusive of a wider array of types of data that could be informative when you're looking at aspects of culture and demographic groupings. So we have a ways to go in terms of beefing up the data that are being collected, but I just wanted to highlight some of the things that we can now pay attention to. And I wanted to just kind of end this introduction on how we can be thinking of how all of these different data points tie together to inform evaluation practice. And I wanted to play a clip from Dr. Kamara Phyllis Jones, who is a professor, a physician, and a past president of the American Public Health Association, in an interview that she conducted with a nonprofit news outlet called Democracy Now! And she speaks to the issues of disparities among different populations and how those disparities impact their experiences, which therefore impact
COVID-19 is exposing U.S. racism in a stark new way. Because the Black and brown bodies are piling up so fast that they can't be, these deaths can't be normalized or ignored. And the way that racism is operating in this pandemic is in two separate fronts. It's increasing exposure to the virus, and it has increased vulnerability to the virus. So increasing exposure to the virus because the way that racism that structures opportunity and assigns value has structured our educational opportunities and job opportunities. We are in more front-facing, low-income, underappreciated jobs where we are part of the essential workforce that really isn't getting its full attention and certainly not getting the full protection that we need. Racism has increased the vulnerability of us to this virus because living in racially segregated communities that are resource segregated without adequate access to food, and our environmental racism hazard segregated, has made us carry in our bodies all of those same diseases: diabetes, high blood pressure, renal disease, asthma, that are making people who get infected to the virus sicker and die faster from it.
Okay, so for the vantage point that I come from, I work in the area of public health. So I am viewing a lot of this information through a public health lens, but certainly there are many other sectors and disciplines that are also affected, obviously, in their, their work is affected by COVID-19. So I just wanted to acknowledge that there is a public health slant to a lot of what I presented, but that doesn't have to color our conversation. That said, I am going to turn it over to Linda, who's now going to set the stage for us to talk about culturally responsive evaluation.
Okay, thank you so much, Sarita. So what Sarita has done was give us a background of what the issue is, but what are the solutions? What can we do? And that's part of what our conversation is here today. So the first question is, what is culturally responsive evaluation? And in short, it is an evaluation where the central focus is of the population or the audience of interest. It is a framework for centering evaluation in culture. In the next slide, you're gonna actually see the framework. This framework was modified or adapted by Dr. Rodney Hobson. He is a former president of the American Evaluation Association and very, very well known in the field of culturally responsive evaluation. And for those of us who are already familiar with evaluation, you will see that this framework looks very much like standard evaluation frameworks that we are familiar with, the CDC framework for program evaluation and and so forth and so on. However, what is important to note is that in the center of this diagram of this framework, culturally responsive evaluation is pointing towards every step of the evaluation process. It is part of it's embedded throughout the process. So that's the main thing that you want to be aware of when you're looking at and thinking about culturally responsive evaluation. You can go on to the next slide. So the question is, what does culturally responsive evaluation look like in practice? And here is an example where you see a graphic and a table of what traditional evaluation looks like versus what culturally responsive evaluation looks like. And in traditional evaluation, it is primarily focused on the evaluator being the leader, and the evaluator's relationship with funding agencies and of the like. Whereas in culturally responsive evaluation, it is very much so a collaborative effort. There are grantees, there are community members, there are external partners, there are clients that are all part of the process from beginning to end. And it's the stakeholders that really drive the direction of what the evaluation will look like. And the role of the evaluator is then the facilitator and convener. Because there are so many different entities, so many different institutions, organizations, and individuals that are part of a culturally responsive evaluation, it is crucial to build rapport and develop a relationship and have trust building not throughout the process, but especially in the beginning, so that you can continue on with the planning. You want to make sure that whatever you are doing as far as the evaluation is concerned is incorporating the diverse thought and worldviews that from the different stakeholders. One other thing that is very important to note is that when you report and when you disseminate findings in a culturally responsive evaluation, you are disseminating to a large community, not just the scientific community, but also the audience of interest. You are with the stakeholders, and the dissemination is drafted in a way that is accessible to all people. Again, not just the scientific community. So we're not going to disseminate to community members peer-reviewed journal articles. We want to make sure that what we're doing is understood by the entire community. And of course, the findings then are used to help build capacity of the community and the organizations that work with the community. You can go on to the next slide, please. So what are some strategies that we could use to help develop culturally responsive evaluation? First and foremost, you want to define and identify who your community is. Who is the audience of focus? And get a sense of, and from there you want to get a sense of what the culture of the community might be. Do some background research. Convene your different stakeholders to do a needs assessment, to understand what the community actually prioritizes and needs. And then you want to understand the nuances of subcultures, if there's language or dialect differences across the community, be aware of those nuances as well. Understand the traditions and community values within that culture, or within the several cultures that are part of the audience that you will be working with. And then the last step or the last strategy that is listed here is talking about engaging the audiences throughout the evaluation process. So going back to that framework, and they are part of the entire process, not just when you need to start collecting data, but in the planning phase, and all the way through into dissemination. So one thing, just as an example, I wanted to give you how that looks like in practice and from personal experience. So I was, several years ago, I was on a project, and this project was looking at breast cancer in young women. And we wanted to focus on African-American women who were diagnosed with breast cancer at or below the age of 40 years. And we wanted to get a sense of what we were looking to find out, what are their needs as it relates to emotional well-being, relationships, reproductive health, and so forth. So in order to do this, we needed to work with multiple entities. We worked with a nonprofit agency, a nonprofit organization that served African-American breast cancer survivors. We also worked with our clients. We worked with researchers and medical experts who were very familiar with breast cancer and how it plays out among African-American women and among women who are diagnosed at 40 or below. And we also learned from the researchers as well, we also had people who were very familiar with health-seeking behaviors of African-American women. And so we had everybody at the table. We also, because we were working with the nonprofit organization, we included and incorporated the voices of breast cancer survivors, and particularly those who were diagnosed at a young age. And so we had the opportunity to do formative research and found out that from them, them being the breast cancer survivors, that they wanted information in one place, because the information is out there that we were asking them about, but they wanted it in one place. And they also wanted that information to reflect their cultural identity. So what they've seen in the past are images and graphics of women that do not look like them, or if they were women of color in the graphics, they were oftentimes clip art and not real women. And so that is just going into one piece of this whole evaluation process, but that kind of shows the steps or the strategies to what I've just described. You can go on to the next slide. And so what we have here is just some things to consider, not so much strategies, but things to consider as you are working to address culturally responsive evaluation. If you didn't hear anything this whole time, know that culture is the center of this type of approach. So participant culture is important. One thing that is also very important to note, and I'm not going to go over every single point on this slide, but just highlight a few pieces, that there are no culture-free evaluators. That is very important. Number one, you want to be aware of, as an evaluator, you want to be aware of where your biases are. And you want to make sure that you make that plain for yourself, but also make it plain and position yourself as you are working in this environment, in the context of evaluation and in the conduct of an evaluation. Because what you need to understand, or what is important to note, is that your biases influence what you observe as you're collecting data and what interpretations you will make of the data. So it is very important to be aware of that and position yourself. The other point to make is, as you are building your relationships with the community, you're building your relationships with other stakeholders. You want to be, you want to approach it in, from a standpoint of humility. And this means that you may not say, hello, I'm Dr. So-and-so from X, Y, and Z university, but take the time as you are building rapport to share about your own cultural background and your own positioning, and understand that this is a learning environment for both the evaluator and the stakeholders. Everybody's learning from one another. That leads me to the next point. Diverse evaluation teams are crucial. It is very important, especially now, to have members of the evaluation team that reflect the community, whatever community or whatever culture it is. Everyone needs to be at the table. It is important because everybody's worldview and background ought to be incorporated, but it's also important, and it challenges us. Diversity of thought can challenge us to do even better, to do even more, to go even further with our evaluation. So I want to note here that just because there are people that look like members of the community on the evaluation team does not mean that we have to forego the relationship building process. You still have to, because there's a saying, I believe Tavis Smiley used to say this, I don't know if he still does, but he says, skin folk ain't kinfolk. And that is really poignant. And just because you look like a member of the community does not mean that the community views you as a member of the community. And so relationship building is still very crucial and important there. As an example, the project that I just mentioned, the breast cancer in young women, almost everybody from among the stakeholders, among the project team at my company, the client side, and obviously the breast cancer survivors themselves were African-American or Black women. That didn't mean that there wasn't a relationship building process. So it's very important to note that. Another thing to note is that the stakeholders' role is crucial. They must be heard and their questions must be addressed as long as it's within what you've agreed for the scope of the evaluation to be. And then the last 2 points that I want to mention are mainly part of evaluation standards, because we do have standards as evaluators that we want to do our best to comply with. The first being, discuss what constitutes acceptable evidence before conducting the evaluation. That's very important, because what you say is, or what you as the evaluator might say is acceptable, may not be what the stakeholder or the community member acknowledges as acceptable. So come and have that discussion before starting the process of the evaluation. And then evaluation results should be viewed as useful and accurate. We want, especially when we're doing culturally responsive evaluation and for the purpose of building the capacity of the community and the organizations that work with the community, we want to make sure that what we find can be used. So that's very important as well. So we can go on to the next slide, and I will give my partner Sarita the opportunity to talk through this slide and share her experience with culturally responsive evaluation.
Thanks, Linda. So I just wanted to share from my own experience some of the strategies that I have used in partnership with programs that I've worked to evaluate and their stakeholders to help ensure that we are attending to the issues of culture and the priorities of the community. And I do want to say that sometimes um, you're not maybe able to fully do a pure culturally responsive evaluation. There's sometimes constraints, um, where you can't always prioritize and make the community's needs the only thing that are fully centered. So in some cases, I've had to use hybrid models of culturally responsive evaluation coupled with more utilization focused and participatory frameworks. But it was really helpful to acknowledge upfront with those stakeholders that, we know that we are working toward better culturally responsive evaluation practices within some of the constraints that we have. Um, and so some of the strategies, in addition to acknowledging the inabilities when we have them to be purely culturally responsive, are to work with them in co-creating the evaluation. So I am not a member of the community that I currently work with to evaluate, but I am part of a larger evaluation team that has quite a bit of representation from those communities on it. I consult with them through an evaluation advisory stakeholder group, and they help to ensure that at every stage of the process, and that diagram that Linda showed us, the circular one with 8 steps, that we are including their voices and member checking what we're doing, and we have a co-lead who helps to facilitate that process to ensure that we are understanding and hearing the wants and needs of the community through their lens as opposed through our interpretation, and try to close some of that gap. And I have to acknowledge we can't always accommodate every request that they may have, but we are working in partnership to negotiate, making sure that their needs are getting met. We also have communities of practice that are focused on attending to the wants and needs of the community as it pertains to their specific aims in building evaluation capacity. One of the areas where this is really important in the communities that I currently work with are that they have a focus on data sovereignty and honoring indigenous practices. And some of the communities of practice that they have are led by the communities themselves, and they are leveraging their gifts, their tools, their resources to build evaluation capacity and advance their aims. One of the things that we did early on to really understand their needs was to do an assessment of evaluation capacity as they perceive their evaluation capacity, as well as their strengths. And we don't use the word weaknesses in this particular community, but we ask them about their wants and opportunities and traditions instead of threats. So some of the orientation from which we're working is asset-based as opposed to looking at deficiencies, and we're very careful to try and be attentive to language that can be perceived within the community as threatening or undermining. So another example of that, instead of using like with the traditional SWOT analysis, strengths, weaknesses, opportunities, and threats, we use strengths, wants, opportunities, and traditions. Another example is, instead of saying targeted populations or targeted communities, we say selected or focused, because the language is a little bit more palatable to this community. And so we also try to, as I was saying, we try to balance achieving methods and approaches and valuing systems in the evaluation that resonate with the community as much as we can. And when we can't, we try to find other ways to accommodate those things that the community wants. So those are just some of the strategies I wanted to share from my own practice. And one of the things I purposefully did was I didn't speak specifically about the program or the community because I am very sensitive to protecting I'm going to turn it back over to Linda.
Thank you. Sarita, we missed the last part of what you mentioned because you were on mute.
Oh, I don't know how I muted myself. I was just saying that I purposefully did not disclose specific details about the community that I work with, because also part of being culturally responsive is not speaking on their behalf. So I'm sharing from my perspective, my experience, and trying to protect their identities.
Okay, thank you. So as we move along, the question is, what are the benefits of culturally responsive evaluation? And by just describing the definition, we kind of talked about what some of the benefits are. But truly, it gives you, as an evaluator, the opportunity to describe the program comprehensively and to have some level of confidence that you are not missing out on a particular population within your audience of interest or your audience of focus. The methods and design of the evaluation would likely address all individuals within the audience of focus. And the results, not only will they represent all the members of the audience or the community that you are working with, but it also is going to be shared and in a way that is accessible to the audience and the community. You can go on to the next slide, please. Okay, so again, as evaluators, I mentioned that we have evaluation standards, but we also have evaluation guiding principles. And there are 5 principles, and I will talk about them. One I haven't put up, but I will mention that as well. But it's important to understand how the guiding principles also support the work of doing culturally responsive evaluations. It's even embedded in our principles. So for example, systematic inquiry, that's talking more about having database inquiries that are thorough and talking about the methodology of the evaluation. And in that principle, we have talking about contextually appropriate, being contextually appropriate. We also talk about ethical implications. And as far as integrity, that is having honesty and transparency in the evaluation process. And as you can see, as part of the integrity principles, there's open communication, disclosing conflicts of interest, making sure that all the perspectives of the stakeholders, clients, and so forth and the like are being considered and concerning the conduct and the outcome of the evaluation. You can go on to the next slide. Respect for people, that's honoring the dignity and well-being of the community that will be, that is of focus. And this is where we get into treating everyone fairly, making sure that we are abiding by ethical principles and standards as it relates to informed consent, confidentiality. We also wanted to do what we can to maximize the benefits of the evaluation and reduce the harms for the groups that are going to be associated with the evaluation. And then lastly, or not lastly, but fourth is common good and equity. and that is talking about just advancing an equitable process. And so we want to make sure that we are balancing the interest of the stakeholders with the common good. Again, there's this idea of transparency, and the last principle within that umbrella talks about your bias and being aware of your bias and assessing yourself throughout the evaluation process. And the one last guiding principle that I did not put on the slide, but is important, is competence. And competence refers to providing skilled professional services to stakeholders. And that is something that we want to make sure that we're doing, that we're abiding by the methodology of evaluation. We are making sure that we are improving our skill set in evaluation, because it's one thing to have the passion for the work that you're doing, but you also need to have the skill and the skill set and continue to grow in that area. So that is related to competency, the principle of competence. We can go on to the next slide. So the question then becomes, why is culturally responsive evaluation relevant right now, as in this period of time, in this moment in history? And so there are a few things that we want to share with you. Number one, we want to use, as evaluators, we want to use our privilege to advance the voices of communities that are often not heard, that often go unheard. We want to make sure that their needs are expressed, and that we leverage the privilege that we have to make sure those needs are heard and then addressed. And the other point is, we want to make sure that we're working with communities in a way that we're not further traumatizing them or disenfranchising them. We've already heard from Sarita the devastation that COVID-19 has had on people. I know people who have personally lost several family members, friends from COVID-19. And so we don't want to be in a place as evaluators where we're deepening the trauma, we're deepening the disenfranchisement. So those are some of the ideas that we have as far as why is CRE, or culturally responsive evaluation, relevant right now. This is the time where we would like to open it up for discussion and questions, if you have them, about why you think culturally responsive evaluation is relevant now in this point in history. If you have any questions, if you have any experiences that you'd like to share as it relates to culturally responsive evaluations, please feel free to, at this point, unmute your mic or type in the chat box any questions or discussion points that you have.
I have a question. I'm an evaluator calling in from the San Francisco Bay Area, California. My name is Nisa Kurtman. I work for a small business and evaluation and research firm, Rockman et al. Most of our clients are in the STEM education field, but the issues overlap, right? So I guess my question, and I just want to thank you very much for this presentation. I feel like there should be more related, and I learned a lot, even though I've been doing this for almost 2 decades. But my question, and that I struggle with, is as external evaluators, we're supposed to approach our research with objective lens. And, you know, folks, I know that a lot of our programs in STEM, they're funded through NSF. We have to approach every program evaluation with that objectivity. When we talk about culture and when we talk about CRE and framing our approach with a specific lens, I feel like that incorporates a level of subjectivity. So my my challenge is how to find the right balance between objectivity and subjectivity, and how to how to navigate that with every project. I mean, it's hard to be completely objective when we consider a lot of these factors that are essential with our work. So I'd love to hear your comments about that, especially when clients kind of push back and say, well, you know, you're supposed to be external and have this objective lens. So, you know, the focus shouldn't be too much on, you know, the culture and differences, but, you know, blah, blah, blah. So yeah, I'd love to hear what you think about that area.
Well, I can go first, and I definitely, we have, you know, lots of other evaluators on the line, so please, you know, unmute yourselves or enter your thoughts in the chat if you have things to share. But um, when I was talking about negotiating, sometimes you have to negotiate, and maybe you can't do a pure culturally responsive evaluation. That was some of what I was speaking to. And so sometimes you have to, you know, negotiate your positionality. But I think one of the ways um, to maintain legitimacy and to be able to continue to build rapport with the community and acknowledge their wants is just to be upfront about what the limitations are, and in the areas where you can advance their concerns, you do so. So to give an example, in the programs that I work with, there are standardized performance measures. They get approved by the Office of Management and Budget before a funding opportunity is even released. Those are usually finite and very difficult to change once a program has, you know, has dispersed funds to the community. And so oftentimes those performance measures can be challenging for community members or recipients of funding to measure and collect data for, and maybe they don't have capacity to do it very well, and they're on a learning curve. But there are other areas where I may be able to have more flexibility in terms of the technical assistance that I provide with them. I make sure that I take in a culturally responsive lens, and I'm not trying to push too hard for things that are not feasible for them to do, or they don't have the resources to do. There may also be other types of data collection activities that can supplement where they may have deficiencies in performance measures, like if they have a local evaluation component where they can incorporate other types of data that are maybe more feasible and accessible to collect, like qualitative data, if that's something that's preferable to the community. But I think that at the very crux, your interactions in being upfront and showing mutual respect in how you work with them is something that you can always do where you may have limitations in other places, you know, about not being able to do a fully pure, culturally responsive evaluation design because you have other stakeholders that you have to negotiate their needs as well.
Thank you. Thank you very much.
Okay.
Hey, this is Chris Vogelai. Can I interject on that piece? Only because I love I love that discussion probably a little bit too much, and this idea of funders or clients even coming to us about this idea of objectivity. And I always have to start that conversation by figuring out what they mean by objectivity. And I had to double check myself, but when I go to the Stanford Encyclopedia of Philosophy, they talk about that people often get confused of the three different types of objectivity. There's objectivity that's faithfulness to the data or the facts you're collecting, objectivity, which is the absence of these normative commitments and this sort of value-free ideal, or objectivity as freedom from personal biases. So I feel like a lot of times when funders want us to use standardized metrics, they're usually coming in from that very top level, that they want us to be able to gather information that's faithful to the constructs that exist, where a lot of the times when we talk about these more nuanced issues in evaluation, especially in the culturally responsive realm, then we're talking really about that third level, that, and it's not even a level of this definition, but the objectivity is freedom from these personal biases, these cultural biases. I'm sure there's a better way to say that, that we pull into all these evaluations and the way we view the world in general. So, okay, I'm off my soapbox, but I just rant about that often. So
I agree with you, Chris, and I think oftentimes, you know, just the selection of what gets measured, the questions that get asked, they're all rooted in that third level of bias. What, you know, there's someone who, or some entity that, you know, prioritized their interests, their worldview in selecting those questions or those measures in the first place. So I just like there's no culture-free evaluation, I am of the school that there is no objective, there's no pure objectivity in most of the things that we do. So I think disclosure is kind of the best policy, you know, to make transparent your subjectivities as much as you can.
I wanted to make sure that you, Sharita, and Linda saw the question from Jana Wallace. What methods would you both recommend to increase self-awareness of one's personal biases?
Well, there are a couple of things, and this is very cliche. One thing you could do, one could do is cultural competency training, but outside of that, just it's a matter of really evaluating why you think the way you think and going down to the core of what that might, what might be, what your worldview is and how you're operating. So it's like, I have this one overall thought and keep on asking yourself, why, until you get to what that core belief might be. I think that's another way to kind of become aware, but that requires a high level of honesty with who you are and why you think the way you think. And I think that's one way. I don't know, Sarita, if you have another way, or if anyone in the audience has a resource as it relates to increasing self-awareness of your personal bias.
Sure. So there are a number of implicit bias tests. You know, if you just wanted to take a, you know, like an exam, kind of like a personality type test that will output for you areas where you may have blind spots about certain biases. So you could do that. But I think that also from a perspective of competence and professional training and background is, you know, to continue to be educated on different frameworks and paradigms and, you know, theoretical stances and positionalities within research and within evaluation. Because I think the more that you're exposed to different types of theory, you know, it helps you to maybe better situate and see where you fit within the continuum of many, you know, ways of thinking and understanding knowledge and knowledge generation and data and what's valid data. And so I would encourage that as a way to, you know, just kind of learn about maybe where your current existing thoughts sit and lie and on a paradigm.
And this is Linda Vo. One fallback, you know, regardless of training and whatnot, that I like to do is checking your own assumptions by asking and laying out, like, these are my assumptions, and checking with the community or the person you're working with, and whether it's in an interview even, I liked one thing that really resonated with what Sharita and Linda said was that even if you look like the community that you're working with doesn't mean you're representing that community. And I find that to be extremely true. Yeah, you can look like that community, but you just don't know the culture of that community, for example. And so checking your assumption will really be helpful just in data collection itself, but in the way you practice evaluation. I see Joy Hall, who is on the call, so I wanted to see if she wanted to chime in, the wonderful Joy. We did a dinner club with her this year before COVID happened, and this is one of the topic area that came up, so.
Hey everybody. I'm glad to see some friendly faces, some folks that I know, and thank you for bringing attention that I'm here. But yeah, this is a topic that I'm very passionate about. I think the suggestions that were put forward are spot on. I know other folks talk about journaling to continuously question their thinking and their processes. Memoing for the qual folks in the house is a common thing, that a strategy that folks use to reflect. I think there's individual reflection, which is good, but also reflecting as a group or with other people, because I think the most critical way to interrogate your own thinking is to do it outside of your own head, right? And so joining in with others, having them join you in that interrogation would be really helpful. But yeah, those are some things that I would suggest. So yeah.
Thanks, Troy. Thanks for call you on the spot.
Yeah, that was fun.
And then Gina also replied, it takes intentionality to think of your why, which can be personally draining, sorry. And that another thought that came to mind was seeing how one's results benefits or harms everyone and anyone, including the culture evaluated. Yes, very valid points. And one of the things that we talked about at the dinner club with Jory was, there's a difference between being reflective and being self-critical, which is what is very draining when you're constantly sort of questioning why in a self-destructive way versus reflectively and thinking about your practice and having a critical thought partner. So I'm gonna hand it back to you, Sharita and Linda, if there's any other discussion points.
Well, I think one thing that we did discuss, or we did mention during this town hall conversation is, now what? What are we going to do? I know that there may be people on the line that are not evaluators, but there's room at the table to do culturally responsive approaches. So now the question is back to you. What are we going to do now? What can we do now, given the skill set that we have? And how are we going to hold each other accountable to it?
That's an excellent question. And, working with youth, I think right now it's especially important to give them a voice and a forum to express, like there's a lot of confusing things that are happening, a lot of milestones that are, that are happening in ways that maybe they didn't think would occur. And so in my own practice, I'm planning to do some volunteer evaluation work where I can implement youth participatory action research as a means to give the young people in communities that I work with a voice and an outlet, for expression. And I'm trying to think of ways with the community partners that I work with to do that. in innovative virtual ways that also give kids opportunity to socialize together in a constructive way. I know that for a lot of students right now, you know, they're very limited in terms of their interaction to you know, to other kids their age, their class, you know, their classmates and things like that, and it's very difficult. So that is one of the things that you know, one of the goals that I hope to actualize as a way to advance my own culturally responsive evaluation practice. I see we have some comments in the chat, and there was one comment about having a data party. Oh, I've lost it.
That's from Giselle Gopez, who is the current AAEA president. The question, or there was a suggestion about having members of your own team look at the data, looking at the same results, data sources and data sets, and seeing how findings and interpretations vary. This is from Nisa, who spoke earlier today. And Giselle's response was, or perhaps holding a data party with program beneficiaries or stakeholders. And I think those are all great ideas.
Mm-hmm.
And something that it ought to be part of the evaluation process if you are conducting culturally responsive evaluation. You're not just making sense of the data yourself as the evaluator, but you are inviting stakeholders, community members, to look at what the data say and come together to draw the conclusions.
This is Linda Vo. One of the things I was working on and supporting, and I won't provide more specific information about topic and location wise to protect ongoing work that's sensitive. I was just helping with note taking for interviews, and you know, as part of that process, we have a debrief at the end of the interview, just to, you know, with the interviewers, with the note takers, and whoever else is on the line that was part of the research party. And this particular investigation was quite, the participant side was quite diverse in terms of culture and language and different things, and in the way that they are able to interpret the interview questions. And one of the things, you know, the research team was sort of disappointed or feeling like they weren't getting what they wanted out of the interviewee, because either they couldn't speak for themselves, their personal opinion, because they had people translating for them, or the responses they were providing was constantly not directly answering the interview questions. And so one of the things I really hope that they took my comments to heart is just sort of, I was basically testing their assumption of the community, and that, you know, in a immigrant population, that perhaps the voice of the children who's translating for them, or perhaps the male person in that family who is also on the phone and speaking on their behalf, like that's the way for them to receive information about healthcare and things like that. And so even though the person they were supposed to be interviewing didn't speak using their own perception and opinions, that in these types of communities, it's the collective unit and not the individual perception. And I don't think that was something that the research group really thought about, that even though they didn't get what they want, that's a key finding, that perhaps the way to intervene and do prevention is through the family unit or the children. And then secondly, you know, just because you didn't answer a certain question, perhaps like they thought there was like no finding, but like perhaps the finding, what they kept reiterating is we text message versus like doing online search and things like that. So it was a lot of, as part of that process, even though I was just helping out to support the team, I hope that like things like that helps others just become slightly sort of testing their assumptions around community culture, and just because they didn't get what they want, they thought that there was no key finding, but I felt like there was a really important key finding for them, even though they didn't have all their questions answered. I don't know if that makes sense. Sorry.
Yeah, that definitely makes sense. And that was a really, really helpful example, and a reminder that sometimes the findings that we're searching for aren't always the findings that we get, and we should be, looking at unintended or unplanned outcomes that often bubble up, and can be very useful and informative to different stakeholders in an evaluation process.
Okay, I do want to, we did talk about sharing resources, and I know that we're 1 minute over, so I won't go too deeply into the sharing of the resources, but we do have a document that we would share with the group. And hopefully you can see my screen at this point. And this is a 2-page resource. I was hoping that we'd be able to add to this together, but we are out of time. But it includes funding opportunities as it relates to COVID-19 that are quickly approaching, except for the final one from Robert Wood Johnson. There's also a call for papers and thinking about long-term culturally responsive evaluation. There are opportunities as it relates to internships, especially if you're still in school, and organizations. I definitely want to highlight Atlanta Area Evaluation Association. They are doing some work to solicit the needs of nonprofits during the era of COVID-19. And so that's something that would be, that could potentially turn out to be a culturally responsive endeavor. And then in general, on an annual basis, the Atlanta Area Evaluation Association has the evaluation support program where they are working with nonprofits to conduct many evaluations, not necessarily a full evaluation, but that's a good place to develop that competency that I was talking about with regards to guiding principles of evaluation. And then there are some places where we would have opportunities to learn and connect. We're familiar with APHA, we're familiar with AEA, many of us, but there's also the Center for Culturally Responsive Evaluation and Assessment Conference. Hopefully will continue to take place at the end of September. And then lastly, the Equitable Dinners event, which is held virtually. And the next event will talk about food equity, which definitely goes into public health, the public health realms. I do want to highlight one of our attendees, Jory Hall, has a new book out on culturally responsive approaches. So I definitely want to, number one, thank her for writing the book and highlight that. But there are also additional resources that are on this document. And I think that is about it. Sarita, do you have any closing remarks that you'd like to discuss?
I just want to say thank you so much for your attendance, everyone on the call who contributed to the discussion. Thank you for your time. We really appreciate you being a part of today's session. Hopefully, there will be more opportunities for us to, continue to advance our discussion of culturally responsive evaluation practice. And I hope that you all found today's session useful. We did have a couple questions about posting the slides, and so I wanted to just see if we could let people know where they can find the slides and the handout
Yes, we will be following up via email to send the slides, and the session is recorded. And we plan to edit that, and we have a YouTube channel, shout out to Chris. So this will be posted on there. And then we have a program page. I don't know if it's gone live yet, but it will also be posted on the website. So thank you both so much. This is a really, really awesome and timely discussion. So thank you, Sharita and Linda, for doing this session.
Thank you so much for having us.
Thank you.
And have a good night, everyone.
Thank you. Good night, and thank you for
Good night, everyone.
Good night.